everyone. In this class, we'll learn about cerebral circulation. The principal arterial inflow to the brain in humans is via four arteries, two internal carotid arteries and two vertebral arteries. The vertebral arteries unite to form basilar artery. The basilar artery and the carotids form circle of Willis. In human, a relatively small fraction of total arterial flow is carried by the vertebral arteries. The average blood flow rate in brain is about 750 ml per minute of tissue. So this diagram showing the vertebral arteries which are going to join to basilar artery and which are going to give branches to form the circle Willis to the branches of the in- internal carotid arteries. And the circle of Willis is going to give anterior cerebral artery, middle cerebral artery and posterior cerebral artery, so which is going to perfuse the brain tissue. Some of the features of cerebral circulation. The gray matter consumes very high amount of oxygen. It accounts for only 1% of the total body weight but consumes about 20% of the total oxygen consumed in the body. The total quantity of blood flowing to the brain is remarkably constant. In other circulations of the body, the quantity of blood flow varies sharply due to the factors such as exercise. The brain keeps up its blood supply despite remarkable change in the perfusion pressure as brain cannot survive anoxic assault. The brain inside a rigid cranial box except in infants before the closure of anterior frontal lobe. That is, neither the blood nor CSF can be compressed. So, if the volume of CSF expands, the brain blood flow has to be reduced, and this is called as Munro-Kelly doctrine. Factors that are going to determine the blood flow, cerebral blood flow. It is determined by perfusion pressure and autoregulation. The brain blood flow will not increase as mean arterial blood pressure increases. Between 60 to about 150 mm of mercury of mean blood pressure, the blood flow is not affected. So this is autoregulation of the brain blood flow. The principal factor in autoregulation is the accumulation of the carbon dioxide. Although myogenic response to decreased distension may also have some role. However, if the systemic blood pressure falls severely below 60 millimeters of mercury, as in severe cardiovascular shock, there is an increased risk of cerebral anoxia. Carbon dioxide concentration. When carbon dioxide concentration of the local brain tissue rises, there is a vasodilatation leading to increased blood flow. Oxygen tension. High oxygen tension in the inspired air produces cerebral vasoconstriction so that the brain is protected from the dangers of oxygen poisoning. Anesthetics. Majority of the anesthetics reduce brain blood flow, example halothane. They also decrease cerebral metabolism. Sympathetic stimulation produces cerebral vasoconstriction. Coming to cerebrospinal fluid fills the ventricle and subarachnoid space. In humans, the volume of CSF is about 150 ml and the rate of CSF production is about 550 ml per day. The CSF turnover is about 3.7 times a day. The choroid plexus of lateral ventricle and also of third ventricle are the main sites of CSF formation. A small part of CSF is probably also formed by the brain parenchyma. The process of CSF formation includes both filtration and secretion. However, the CSF is not pure ultrafiltrate of the plasma. The cells of the choroid plexus also secrete in addition to filtration. The composition of lumbar CSF is essentially the same as that of brain ECF, extracellular fluid. That is nothing but the 15% of the brain volume that makes the 15% of the brain volume. The constituents of CSF are mainly the sodium, potassium, chloride, glucose, protein, and pH, and their concentration are given in the brackets. And the pH of CSF is around 7.3. If you see the circulation, the CSF thus formed comes out of the lateral ventricle. It enters into the third ventricle through foramen of Monro, then passes through the aqueduct of Sylvius to enter into the fourth ventricle. Then from there it escapes mainly through the foramen of Luschka and Magendie and occupies the subarachnoid space and is distributed all over the brain. A small part of CSF enters the central canal as well. Its absorption. At the sagittal sinus, finger-like projections called arachnoid villi are seen to project from the arachnoid matter. These arachnoid villi come in contact with the venous blood of sagittal sinus. The membranous structures which separates the CSF within the arachnoid villi and the venous blood of sagittal sinus consist of arachnoid matter plus meningeal layer of the dura mater. The epithelium of this membrane shows pores. When the pressure in the CSF, that is within the arachnoid villi, is high, the pores open up and the fluid escapes into venous blood. But the venous blood cannot enter villi because pressure within these sinuses are normally very low. If there is any rise in venous pressure within these sinuses, the pores will close down. Further, the colloidal osmotic tension of the venous blood of plasma is high. That is, it is because increased concentration of plasma proteins. Whereas that in CSF, that is of the villi, is very low, which also aids in the transfer of CSF to the venous blood. As a part of CSF is absorbed via the arachnoid villi into the venous blood of the cranium and the spinal cord. So this is how the CSF is produced in the lateral ventricle and also in the third ventricle. It enters into the third ventricle, then into the fourth ventricle, and then from the fourth ventricle it will be reabsorbed from the Luschka and Magendie, and then it enters into the subarachnoid spaces. Then it is distributed all over the brain, okay, from where it is going to be absorbed into the sinuses like sagittal sinus. Functions of CSF. It forms a sort of a cushion around the brain. If the head receives any injury because of the presence of CSF, the impact of injury is distributed all over the brain, and thus no single area of brain has to bear a high degree of impact. If there is an edema of the brain as a result of brain injury or inflammation, the CSF escapes from the subarachnoid space into venous sinuses and thus provides some room so that brain is not pressurized. It may carry nutrients to the brain. Some of the applied aspects related to CSF are the lumbar puncture. In some diseases, it is necessary to examine CSF for diagnostic purposes. For this, a needle is passed between third and fourth lumbar spinous processes into the subarachnoid space within the vertebral canal. The spinal cord ends at the level of spinous processes of L1 or L2 vertebra. The other uses of lumbar puncture are it is used for diagnosis of meningitis, multiple sclerosis, and subarachnoid hemorrhage. It is used as therapeutic as well to administrate the antibiotics and anti-tumor drugs, and it is used to give anesthesia to administer spinal anesthesia. Abnormal CSF in cerebral arachnoid hemorrhage. In cerebral or subarachnoid hemorrhage, the CSF contains blood. In purulent meningitis, the CSF is cloudy, cell count is high, and consists of mainly neutrophils. Chemically, sugar concentration falls, protein concentration rises. All these features are due to the acute inflammation of the meninges. In viral encephalitis, the rise in the protein concentration may be the only abnormality. Hydrocephalus. The aqueduct of Sylvius may be constricted due to the certain forms of neurocephalus or tumor, and the CSF accumulates in the third and lateral ventricle but fails to appear from fourth ventricle onwards. As a result of the accumulation, intracranial tension rises, the brain matter is pressurized, leading to considerable damage to the brain. The foramen of Luschka and Magendie may be obliterated following inflammation to the meninges, leading to a similar conditions. Blood-brain barrier, the tight junctions between capillary endothelial cells in the brain and between epithelial cells in the choroid plexus, effectively prevent proteins from entering the brain in adults and slows down the penetration of smaller molecules. For example, the slow penetration of urea. This uniquely limits the exchange of substances into the brain is referred as to a blood-brain barrier. Uh, Through the tight junctions, the endothelial cells of the brain capillaries, particles with molecular weight more than 2000 do not pass through. However, at some sites, the endothelial cells are covered by food process of astrocytes. This covering is, however, incomplete and large enough to permit substances with a molecular weight of 40,000. If any substance has to cross this wall, it has to penetrate the cell membrane of endothelial cells. So only lipid soluble materials cross this barrier and others do not. The blood-brain barrier prevents the entry of many injurious substances to the brain, as the brain is more delicate and vital than other tissues. Triple response. When skin is stroked firmly with pointed object, it evokes a series of response classified as a red reaction, flare, and a wheel. Red reaction. Reddening appears over the line of stroke. Red reaction in 10 seconds occurs in 10 seconds due to the capillary dilatation and release of histamines. Flare, when redness spreads out from the injury. Flare appears within 30 seconds after appearance of the red line. It is due to the dilatation of arterioles. Skin temperature overlying the area is raised. The mechanism of arteriodilation is due to the Axon reflex, which is a response in which the impulses are initiated in the sensory nerves by the injury are relayed antidromically down to the other branches of sensory nerve fibers. The neurotransmitter the released in the central transmission of sensory C fibers neurons is substance P. Substance P, calcitonin gene related peptide, dilates the arterioles. Flare is absent after local anesthesia. And wheel occurs when, if the stroke is strong enough and swelling is developed within the flare area. This localized edema is due to the increased permeability of capillaries and post-capillary venules with the consequent exacerbation of fluid. Increase in the permeability is produced by the release of histamine and related substances. Substance P causes extravasation of fluid, and wheel does not depend on the nervous mechanism. So this mechanism is axon reflex, where the sum of the sensory nerves, the impulses which are supposed to travel to the spinal cord, they also travels to the capillaries. They innervate and causes the dilatation of the arteriole, which leads to a flare. Okay, and this transmission occurs mainly antidromically. So this is in brief about cerebral circulation. Thank you.